Hello, ladies and gentlemen. Thank you for joining me here on this live webinar from beautiful Ojai, California. Our subject today is on understanding natural treatments for nerve pain according to Ayurveda. Of course, there's many types of neuralgia. We have sciatica, nerve, is what we're going to be talking about today in terms of sciatica. Nervous system in general, often resulting in type of tingling, numbness, and neuropathy. But there's many types of neuralgia throughout the body based on the different nerves. We can have facial neuralgia. We can have different nerves in the body can be painful. So the treatment we're going to talk about is in a sense general, talking about all types of nerve pain. Some types of headaches and migraines are caused by inflammation of the nerves. But in Ayurveda, the meja datsu, or nerve tissue, managed by Mejavaya Sutra, the nervous system, is governed by Vata dosha. Of course, if you know Vata, this is the qualities of dry, light, cold, rough, and mobile, active. And when these qualities are too high, too dry, dehydration, too cold, as in creating blockage in poor circulation, too rough, too much rough food, not enough oil, fat, soothing substances, too active, physically, mentally, and too light, kind of a dehydrated, depleted state. All these gunas are created on the body, increase these actions, so to speak, increase the vata. And then we have vata vadi. And vata vadi, it means high vata, particularly in the nerve and the muscular system. And we know that there's no pain without some imbalance of vata. So we know vata is the cause of our nerve pain. So in Ayurveda, we're focusing on vata, and there's also vata pushing pitta, and there's pitta blocking vata, and kapha blocking vata, and even ama toxins blocking vata. But vata is what our main focus is. So that means we're balancing these qualities of dry with moist and oily and more fat in the diet, because we know fat supports not just the brain, but the bones and the nerves and all the tissue in the body by its membrane. We're balancing the cold nature by using warming herbs, warming compress, and soothing herbs to balance the rough nature, building, strengthening, building cartilage, building fat, because of course, pinched nerves or pressure on the root of the spine, blocking nerves, particularly sciatica nerve, and we have pain. And this is due to the depletion of the tissue, cartilage, fat, muscle, in particular, and creating bone on bone, cracking joints, pressing of nerves. So it's become the depleted quality of vata. So this can come from people who are fasting, juicing, low fat diet, not having enough protein, vegetarian, vegan, and other maybe no grains too, because also a type of depletion that can aggravate the nervous system we know is B6, B12, and these are coming from our grains. So depletion of the tissue, datsu chaya, depleted tissue, is going to create pain, and also blockage of the sutras is going to create pain. So these are the two causes of pain: blockage in the system. All tissue have systems supplying the nutrients and removing the toxins and the waste matter from the metabolic process of making the tissue. And when these channels are blocked, sutras, then there's pain. When the tissue or muscle is, or nerves or bones are depleted, we could say type of undernourished, and more vata, more air, then like an osteopenia, osteoarthritis, and we're going to also have pain. So these are the two causes of pain in the nerves according to Ayurveda. And it's important to understand this because you have to be able to classify yourself or diagnose yourself, or of course, if you come to an Ayurvedic practitioner, he needs to classify you. There's many types of all conditions in Ayurveda and many types of nerve pain in Ayurveda. We covered a few. Vata dominant type, was this moving or scattered around the body and changing places. And then there's Pitta type, where Vata's pushing Pitta, and then Pitta gets high. What's qualities of Pitta? Hot and sharp. Added on to this would create a burning sensation, inflammation. And so if there's burning, heat, inflammation, and a penetrating type of pain, then we know Pitta is involved. So Vata can be pushing Pitta, increasing Pitta, like the air increases the fire. And Pitta can also block the channels of Vata. And then in other cases, we have Kapha, can be too much and block the channels. And then the fourth type is Ama, metabolic toxins accumulated in the body from poor digestion and elimination, creating toxins that then go out and circulate through the body and lodge themselves in the nerves, the joints, and the muscles, creating this inflammation and pain. So these are the different causes: Vata type, Vata pushing Pitta, Kapha blocking Vata, or Ama, or toxins blocking Vata. These would be the three major types. So once this is determined, and this can be determined quickly by the Ayurvedic practitioner just by probably looking at you and asking a few questions and getting an idea of the symptoms. The Kapha type and Ama type is going to be more sluggishness, deep stiffness, and it could be more muscle stiffness than there is sharp penetrating pain, dullness, and even maybe a tendency towards depression than anxiety when there's a lot of Vata. And with Pitta, with that heat and burning, there's going to be more of a tendency towards irritability, short-tempered, and anger. So that's one way you can tell which dosha is affecting the nervous system, is by the mental state of the person. So we know that there's many causes of sciatica in particular we'll focus on today. And the main being, of course, just pressure on the root of the nerve in the spine. A disc pressing together and pressing the nervous system, which is a type of depletion. There's no cartilage. Of course, a slip disc will also create sciatica, ruptured nerve fibers, arthritic conditions where there's joint pain, muscle pain throughout the body. When you have the systemic inflammation, of course, the nerves are very sensitive. You're going to have nerve pain, and this needs to be treated together: joint pain, muscle pain, nerve pain. Even though some herbs have an affinity towards the nervous system, there's many herbs that will help bring down systemic inflammation. Also, just severe constipation can bring on sciatica and nerve pain. Abdominal growth, like a tumor, could create pressure on the spine and create sciatica type of pain. And of course, an infection in the the nerve tissue itself, like in the case of herpes or shingles, where the nerve becomes inflamed, and that's Pitta, by the way. So you have more burning sensation in that case. And of course, just poor posture and poor diet, poor nutrition can be other causes. There's other home remedies, of course, to help out. Of course, don't over-exercise, don't lift heavy things, put your feet up on a pillow at night. In the case of sciatica, use warm, hot compresses, take hot salt baths. As far as neuropathy, neuropathy, it can be caused by diabetic conditions, high blood sugar, because the high blood sugar is damaging the nerves. You get numbness, the tingling, and then ultimately damage to the nerves. It could result even in amputation. So high blood sugar needs to be treated immediately if you have neuropathy, because that's the cause. You don't want to just treat the neuropathy, you have to treat the cause, and this is another subject. And also just poor circulation over the years. If your hands and feet are cold, particularly the tips of your fingers are very cold and you have numbness and tingling there, and this is a type of blockage in your circulatory system, Raktavaya Sutra. The nutrients aren't getting to the nerves and supporting the other tissue, and then you have numbness and tingling, and ultimately can really lead to nerve pain in the extremities, where due to this poor circulation. So there's many causes of nerve pain, needs to be diagnosed, but Vata is usually the main doshic imbalance that is affecting this type of nerve pain. Now, there's some general dietary guidelines we can give to help inflammatory nerve conditions, but ultimately, diet needs to be adjusted for the individual because it depends on their type of nerve pain and the causes. But we could say that we don't want to increase vata, so all vata increasing foods would be eliminated, particularly beans. Beans are always eliminated for sciatica and many nerve conditions. They create a lot of air. They're very light. They're very depleting. They're good for weight loss. They have a lot of insoluble fiber, which is cleansing in a sense, but it's not nutritional and building as, say, animal protein is. So generally beans are not used, particularly large beans. Fried food is avoided, and bad oils, bad fat, trans fats, because oil supports the nervous bone tissue and the nervous system, as well as the reproductive system, of course. But particularly the nervous system is very easily aggravated if there's low fat in the diet, and can lead to even dementia and other neurological problems just by a low fat diet. So, and bad fat or poor liver function results in, unhealthy fat, and then the nerves can suffer. So you want healthy fats, butter, ghee, whole milk are very important. Avocados, olives, oily food. So it's kind of a high fat diet, but it has to be good fat. And also we want to avoid too much sour, like grapefruit, vinegar, and very hot, pungent, like chili pepper, cayenne pepper. Not only cayenne pepper can increase pitta, burning and heat sensation, but also hot peppers are very drying, and this is increasing vata. So chili peppers out. Alcohol is very depleting. Not alone its other toxic effects on your liver, but it's depleting to the tissue because of its hot, dry, light nature, increasing both vata and pitta. Those would be the general guidelines. If you had pitta and there was inflammation and there was a pain, particularly if it was in the joints and the muscles, you'd want to avoid the nightshades, tomatoes, eggplant, bell pepper, and white potato. If you're very vata and you're thin and you're depleted, you want to avoid the cabbage family, cabbage, broccoli, cauliflower, kale, because these are too depleting. And being flowers, they're cauliflower, they don't have substantial nutrients to ground the vata dosha, so they should be avoided when there's high vata or weakness or depletion in the body. But again, this diet should be adjusted for the individual. So some lifestyle changes need to be made in most cases. Better sleep, maybe sometimes less physical activity, more rest to reduce down vata. And also some changes in the diet need to take place, maybe more fat, maybe less legumes, less hot, spicy, sour foods, more home-cooked foods, and can make a big difference. Then herbal treatments can build on top of this. The diet alone won't be a cure, but at least it will allow the foundation. And definitely the wrong diet, the wrong food, spicy, hot salsa, chased down with some alcohol and a cup of coffee, it would definitely aggravate your nervous system. So, but by eliminating them doesn't necessarily mean that your nerve problem is going to go away. There we need treatments that are designed to treat these conditions. So we'll go through some single herbs, both Western herbs and Indian herbs, and talk about herbs that are used for nerve conditions, particularly nerve pain, and particularly sciatica and neuropathy. The number one herb would be, of course, ashwagandha. This ashwagandha was hand collected in Tamil Nadu outside of Kerala, where I stay, by an associate of mine, and hand picked, wild crafted, and then it was soaked in milk before being processed. Because ashwagandha is one of the premier herbs for balancing vata, and we want to balance vata very quick. It's very good for the nerves, very good for stamina. It's very calming. It's like food for the nervous system, but it can increase pitta. But when you soak it in milk first, then it takes away that pitta increasing aspect. It becomes more sweet, more smooth, more building, more nutritive. So this is a very fresh batch, only a couple months old, been soaked overnight in milk before it was dried. So this is very high quality ashwaganda, and very important for a proper, effective, and quick treatment. You can't just know the herb. You have to have a good source of a high-quality herb, little capsules of herbs that have been around for a long time, or not organic or not fresh from a previous season will not give you the same benefits as fresh, high-quality herbs processed in the right way. The next most important herb in Ayurveda for the nervous system would be a bramhi. Here you can see organic bramhi. And here, bramhi is good for the mind. It's balancing vata and kapha. Vata and pitta. It's sweet, cooling, and nurturing and healing. So it's very good for the mind and very good for balancing vata and pitta in the Mejadatsu, the nervous system. And then here we have dashamool churna. Dashamool churna, again, organic. Dashamool, dash means 10, mool means roots, so it's 10 roots, and it's very nourishing and very anti-inflammatory, and also well known to balance vata because of these roots are very grounding and have a lot of minerals. So it's anti-inflammatory, vata balancing, and very nutritious, a lot of vitamins in it. So dashamula is used a lot in nerve conditions, you'll see. And this is kaunch, or better known as kapikachu. It's famous because people are aware that it helps with Parkinson's, and there's a lot of research being done now on kapikachu and its wonderful effects on neurological problems, including MS and particularly Parkinson's. Here we have bramhi chopped and sifted, so it could also be taken as a tea and be drinked all day long. We have a tea called brain tea, which is mostly bramhi, and this could help a person who had a nerve problems plus maybe some memory problems, and drinking brain tea all day would help their nervous system, balancing vata, balancing pitta, and improving their memory. Western herbs like chamomile are also nervines, mild sedatives, helping antispasmodic, and flowers, so very cooling and balancing both vata and pitta. Skullcap also has some analgesic effects, helping with pain, mild sedative. Oat straw is very healing and nurturative to the nervous system, and very important for recovery after nerve damage or nerve even surgery, where you've had surgery on the nerves. A lot of oat straw can help the nerves heal sooner. So those are some Western herbs, and then they could be made into formulas. We'll start here with the main formula we use for neuropathy, which is very effective. And you can see the ingredients we mentioned right there: ashwaganda, chandraprava, bramhi, and dashamool. Dashamool, of course, is 10 herbs. Chandraprava is about 20 herbs. And chandraprava has gugulu in it, which is a resin related to frankincense and very good for muscle pain, joint pain, nerve pain. And shilajit, which is a mineral high in trace minerals. But both of these are very heating, so they added other herbs to make it cooling. Chandra means cooling. So chandraprava is very good at opening channels, clearing channels, but this is a cooling formula, so very suitable for tissue that requires a more cooling approach, like the nerves. So, and even the kidneys for that matter. So it's being used for also for blockages in the kidney. Chandraprava, ashwagandha, bramhi, dashamula. That's a very wonderful formula for neuropathy. And as you can see from the label, it should be taken with either 1 or 2 teaspoons of ghee or in warm milk twice a day between meals, about an hour after meals. Now, if the person had a lot of pain and inflammation in the body, we could also include something for systemic pain. This is boswellia extract. Boswellia, of course, is a resin as well. Frankincense in particular, and this is the extract. Amlaki is, of course, high in vitamin C, super antioxidant. There's turmeric, very famous. Little pipali, which is a little smoother than black pepper. And curcumin extract, which is the main ingredient here. That's 95% pure curcumin extract. So these very, very effective anti-inflammatory. So some person who has, say, neuropathy plus inflammation, we may give them both formulas, 1 teaspoon of each twice a day between meals with in warm milk. because you have to have some fat. In fact, many of these herbs come in fat. We can see because it's so important to have fat when treating the nerves. Here's one called, it's called Vitality Ghee, but it's actually ashwaganda grita. It's just ashwaganda ghee. Very good for the nerves. Would be given out as a supplemental herbal formula for anybody with fatigue and weakness and who is underweight. And we spoke earlier about kapikachu or kaunch, which is used for nerve damage, particularly Parkinson's, where they're doing a lot of research on it. And we call it, of course, nerve ghee here, but basically it's a kapikachu or kaunch and the seeds, and it's for tremors, weakness, depletion, and again, this is taken in warm milk. So that could be a supplement to the treatment if there was tremors. Now, if there was pain also in the joints or the muscle, we may include this, Pitta detox tablets. This is Kaishor Gugulu, another Gugulu, but Kaishor Gugulu is a cooling Gugulu, not hot, so suitable for Pitta, so we call it Pitta detox. It's going to help with muscles, joints, and nerves in cleaning the toxins out of these three tissues and reducing pain. Here's a Vata version called Deep Detox, called Yogaraj Gugulu. And so, there's different Gugulus that could be used there. Yogaraj Gugulu. Oh, see, it says right there, joint pain, nerve pain, stiffness, and muscle pain. So those could be combined. So you could be taking your formula every day and then taking a capsule as well, and maybe even one ghee. Here's some, and if you had sleeping problems and pain at night, we could give you tagar. We call it sleeping capsules, but it's just tagar in capsules. Tagar is a sedative, actually analgesic and sedative and nervine, so that's perfect if you're having nerve pain at night and can't sleep. So that could be added. If you're having anxiety or nervousness, we want to further support the nervous system, we can have a calming formula, and you can recognize many of the same herbs. Ashwaganda, jatamansi, which is a flower, very good for balancing vata and pitta. Shank pushpi, cooling nervine. Bramhi, of course, we talked about, premier nervine. And tagar, mild sedative, analgesic. Together, this would help with nervousness, anxiety, and panic attacks. Those could be supplemental products that could be provided as well to cover some of the other symptoms. And if just person was a little nervous, a little anxious, overthinking, then we could just provide some Western herbs like this relaxing tea. Lemon balm, skullcap, catnip, motherwork, lavender, oat straw. Remember we showed you that. It's good for the nerves. Passion flower, premier nervine in Western herbalism. Rosemary and cinnamon are just catalysts, making it work better. And there's rose petals, which are just there because it makes it smell wonderful, and people enjoy the tea with the rose petals more. Now, if there was headaches or nerve pain in the head and you were having to take aspirin, we wanted to get the person off the aspirin, we can just give them a natural form of aspirin there. White willow bark, basically, and feverfew. This is a well-known formula for headaches. White willow bark, of course, is what aspirin was made for. Feverfew is known for also helping with headaches. Chamomile, sedative. Skullcap, sedative. Nervine, analgesic. And licorice, kind of a catalyst, bringing it all together, making it work well. And licorice, of course, balancing both vata and pitta. So you could have your main formula, and then there could be some supplemental formulas on top of that. And then once you reduce the toxins and the ama and the digestion was better, because these would have to be addressed too. Your digestion, your elimination, constipation is a common cause for sciatica. So would have to be treated first, even before, taking these herbs for very long, or it would be fruitless. Same with the diet. The diet has to change right away before starting on the herbal protocol. And elimination has to be good, sleep has to be good, digestion has to be good. These are all the factors that are important. You can't treat a person's issue in isolation and not, treat the whole person, because, your digestion, your sleep, and your elimination, just to name these three, are important. Even your respiratory system. If you're not breathing well, snoring, and clogged, then you're not getting enough oxygen, your immunity drops, and we have a cascade of issues if any system in the body is not working well. So really have to look at a person holistically and help them in that direction, a holistic treatment, not just only one jar of herbs for the nerve pain. It doesn't work like that. Now, Also, we can put some topical oils that are made for pain. This one's called Vata, oils. It's kind of like a relaxing and warming oil. You can see some of the same herbs that we talked about there. Ashwaganda. And there's Bala, which means strength. There's licorice. Bringraj is another Ayurvedic herb. Passion flower, Western herb. Shatavari. And there's a little valerian in there. So, you can see how this is going to be warm, relaxing. You can put it on your head for headaches, put it on your feet to relax, put it on your whole body to treat your entire nervous system very quickly. Getting a full oil massage of that type of oil will address your nervous system throughout the whole body, particularly if you put it on the part where you're having the nerve pain. It will help. Now, if you're having heat and warm sensation, you don't want to put more warm oils on it, so we use Pitta oil. It's cooling and calming. And there's the Brahmi again, Guduchi, which is cooling, Shatavari, balancing Pitta. This Manjista, passion flower again, nervine, little licorice, balancing Vata and Pitta, coriander cooling, mustak cooling, and a little lavender. So a little mix of Western and Indian herbs in that formula. And this could be also applied topically to the areas where you have nerve pain. Now, usually when people change the diet, they see it's not getting worse. The condition often stabilizes but doesn't get better. At least they're not aggravating it with the coffee and the beans and the chocolate and the tomatoes and these things that aggravate your nerves. Any stimulant will aggravate your nerves. And so then they start taking the herbs and they start getting better. You may have to take for a few months, a few jars. And then, if the condition still, after a few months, is still there, particularly sciatica, then we do dashamool enemas with some sesame oil. So we have these enema herbs. We just put them in a bag called Vata Basti or Vata enema herbs. And it's basically dashamool cut and sifted, just like I showed you there, the powder. We also have it cut and sifted. It looks like mulch, It's a bunch of herbs just chopped up and shredded. And you do a decoction with these, strain it off, add about 4 to 8 tablespoons of sesame oil, and do 6 enemas in a row, day after day, when the bowels are moving good and the colon is empty. I give you instructions, of course. And then the 7th day, we put more oil. And by this dashamool sesame oil treatment in the colon, you really address the lower half of the body. This works very quickly for sciatica, bad cases of sciatica, we do this, or chronic cases that aren't getting that 100% improving, and even a neuropathy, particularly in the lower half of the body. This works very well, these dashamool oil enemas. Not all the time it's even necessary. I have many testimonials for people who had nerve pain, sciatica, neuropathy, other types of neurological issues that did not need these oil enemas, but some seemed to be necessary and always turned out to be very beneficial and very quick in results. Well, the herbs take a little longer. But the combination of the right diet, change of lifestyle, properly prescribed herbal formulas of high quality, and then some external treatments of oils is very effective at treating and curing many nerve conditions, because we're not taking just analgesic herbs and painkillers or suppressing our immunity. We're actually treating the underlying causes, in this case vata, pitta, or depletion, which we can see by heat, burning, dryness, roughness in the nerves and the body. So we're eliminating these causes. So 3, 4, 5, 6 months, not only do you not have the nerve pain, but it's not going to come back unless you repeat these causes again. So it's very important to treat the person holistically. It's very important to be patient and stay on your program for a little while, not be impatient and expect immediate results, and realize you're trying to resolve the condition and address the causes. And you have to remove some of these causes, which could be your chocolate, your over-exercising, you're not having enough fat, or it could be many things that you're doing that are not making it possible for your nerves to recover, and may even be making the condition progress. So it's very important to have somebody diagnose your nerve condition and and see what stages it's in, how much you've progressed. Early stages, you just have a little tingling and numbness, and then later you could get little spasms or tremors, particularly when the muscles are depleted too. And then if vata gets too high in the pranavaya sutra in the mind, then there's anxiety, nervousness, spaciness. This is other signs of high vata. And if pitta is very high, then you can get signs of burning hands, burning feet. So this is as it's progressing. So when you got this depletion of vata, this heat and penetrating qualities of pitta in your nerves, it's very, very painful. And this can result in nerve damage that can, result in conditions like Parkinson's and MS and many forms of dementia. And of course, nerve pain, which is what we're talking about here. So, this is the Ayurvedic approach. I hope it helps you to understand the potential of Ayurveda and how it manages and treats many types of nerve conditions. So feel free to contact me if you like more information about my services. And feel free to complete my online form, which gives me information about your condition, allows me to better have a conversation with you about what the possibilities are. Otherwise, just schedule an appointment and on Zoom or Skype or in the clinic, and I'll provide you with the herbs or mail them to you if necessary, and you can begin your treatment. And keep in mind, you will be treating yourself because you'll be the one following the protocol, following the diet, and taking the herbs. So ultimately, when you're better and you recover, you will be the one that did the work. But through the help and guidance of Ayurveda. Thank you very much. Hope this webinar helped you to understand the potential, sophistication, and benefits of an Ayurvedic treatment for your nerve condition. Thank you.